Hi everyone, in our video we will be guiding you through the occupation of brushing your teeth. Let's get started.
Our area of occupation is activities of daily living. Our occupation is personal hygiene and our activity is oral hygiene. Our client is 21 years old, male, Asian Vietnamese, is in the middle class for their sociocultural background, and is moderately active. The space demands for our activity include good lighting, wide counter space, a clean sink, an open floor plan, room temperature, and room temperature water. The social demands for our activity include being expected to brush at least twice a day and brushing for at least 2 minutes. Poor oral hygiene can be linked to low self-esteem, as there is a need to have a quote-unquote perfect smile. Poor oral hygiene can also be linked to heart disease and other health conditions. It can also affect one's mental health by decreasing their longing to go out. For our supplies, we will need fresh, minty, whitening, desensitizing, and antibacterial toothpaste, fresh, minty, antibacterial mouthwash, and a lightweight, soft, quick-drying, absorbent towel. For our tools, we will need a toothbrush with rounded bristles and a long and comfortable handle. We will also need a flat and angled tongue scraper with a comfortable handle as well. For our equipment, we will be using a sink or faucet that's durable, stain, hard water resistant, easy to clean with a single lever, and a hot and cold dual setting. Depending on the client, you will also need a step stool for stability and security that locks into place.
When looking at oral hygiene as an occupation, we can identify different areas of occupation that oral hygiene can help balance. In an individual, oral hygiene can be built into one's routine, which can help build time management around the routine and lead to developing an overall healthier lifestyle. In groups, we can see oral hygiene has become a social norm, which makes it seem more appealing, and it also helps us keep each other accountable to maintain good oral hygiene. And when we look at populations, we see that good oral hygiene is recognized and even more established as a social norm, which can further establish developing oral hygiene as a routine. Next up, let's look at how oral hygiene plays an important role in the promotion of health. In individuals, it's been proven that good oral hygiene can prevent the onset of oral decay and cardiovascular diseases, as well as increase one's self-esteem and confidence, which can lead to more social participation. In groups, oral hygiene can promote economic and social benefits to families. According to the National Library of Medicine, good oral hygiene prevents oral decay, which can prevent extra dentist appointments and unnecessary medical bills. Good oral hygiene can also promote health throughout families by habituation. Lastly, we can see that good oral hygiene can increase overall wellness and improve social participations in various populations and communities. Lastly, let's look at how oral hygiene can aid in the prevention of disease, illness, and dysfunction. When looking at a person, we can see that eating and speech can be impaired as a result of poor oral hygiene. But regular brushing reduces bacteria and plaque that causes gum disease and tooth decay. In groups, we can see an overall improvement in social connectedness, an increase in social interaction, as well as a decrease in isolation, insecurity, and depression. In populations, good oral hygiene can decrease the percentage of those at risk for gum disease. According to the American Psychiatric Association, taking care of oral infections, oral inflammation, and implementing good oral hygiene can prevent systemic diseases such as Alzheimer's. This is our client who will be performing the occupation.
Using one hand, grasp onto the handle of the bathroom drawer. Pull towards the body. Gather toothbrush, toothpaste, and tongue scraper and place them on the countertop. Grab onto toothpaste with the palm of one hand. Using the other hand, unscrew the top of the toothpaste counterclockwise and place the lid and toothpaste back on the counter. Pick up the toothbrush in one hand. Using the other hand, lift the faucet handle up to turn on the water. Place the toothbrush under running water and turn off the faucet. Pick up the toothpaste and squeeze the toothpaste onto the bristles of the toothbrush. Place the toothbrush back onto the counter and pick up the toothpaste lid. Close the toothpaste by screwing the lid back on clockwise. Place the toothpaste back onto the counter. Pick up the toothbrush with one hand and bring the toothbrush into the mouth. Brush teeth for 2 minutes.
Once your 2 minutes is up, position your face above the sink and expel the contents from your mouth. With your free hand, turn on the faucet and place your toothbrush under the running water to clean off the remaining toothpaste. At this time, you may also utilize your hand to assist. Once your toothbrush is thoroughly rinsed, place the toothbrush back on the counter and rinse your mouth by cupping water with your hands and bringing your hands up towards your mouth. Pick up your tongue scraper and briefly place it under running water, then begin scraping your tongue from back to front. Once you're done scraping, place the tongue scraper under running water to help clean, utilizing your hand to help brush off the remnants. Rinse your mouth if necessary, then turn off the sink by pushing down on the faucet handle.
Grab mouthwash from drawer. Use free hand to unscrew top of mouthwash counterclockwise and adjust hands as necessary. Pour contents of mouthwash into lid of mouthwash. Place mouthwash bottle on the counter. Lift the small cup towards your mouth, pouring the contents into your mouth. Place the small cup back onto the counter and swish mouthwash in your mouth for 30 seconds. After 30 seconds, expel the contents of your mouth into the sink and turn on the sink by pushing faucet handle up. Cup hands under running water to rinse your mouth. Turn off water by pushing faucet handle down. Pick up mouthwash and lid of mouthwash and close the mouthwash by screwing the lid clockwise. Place mouthwash back into drawer and grab towel to wipe mouth. Place towel back down. Grab toothbrush, toothpaste, and tongue scraper and place them back into designated area. Grab handle of drawer and push in. Thank you for watching. We hope you found our video informative and helpful.